Hi friends, I am Dr. Ashutosh Gupta. I am a consultant in fetal medicine. So today we shall talk about an entity called as an increased nuchal translucency. Right. So when the fetus is there, so there is some amount of fluid which is there behind the neck of the baby, which we measure and which we call as a nuchal translucency. Right. So the time from which this nuchal translucency can be measured is pre-laid. And whenever the translucency is greater than 95 centile for that CRL, we identify it to be abnormal, right? So whenever the NT is greater than 95 centile, so it can be associated with a lot of conditions across. So this could be cystic hygroma, this could be Down syndrome, this could be aneuploidy, could be microdeletions. We can have some cardiac abnormalities, and this can be a normal entity, a transient entity also, that we need to identify and understand. At something around 14 weeks, the resistance of the uterine arteries decreases appreciably first. Secondly, the fetal kidneys, they start to function at something around this time only, 13 to 14 weeks. So something around by 14 weeks, the baby is able to excrete, get rid of the excess amount of the water which is there to the baby, and therefore this nuchal translucency could be transient. If it is a persistent, called as an hygroma coli, this needs further evaluation. So in these slides, I'll make you understand. We'll try to understand. I'll show you that how do we look around and how do we investigate the baby, and if all these things are normal, this is very reassuring, right? Friends, there are three things to talk about. First is called as cystic hygroma. So the differentiation between the increased nuchal translucency and cystic hygroma, it is all radiological, right? So you do have fluid in layers and layers to the baby. Cystic hygroma is definitely a radiological diagnosis. Increased nuchal translucency is exclusively a nuchal translucency which is there in the neck, right? So probably we need to look around for some microdeletions, some cardiac abnormality, as well as the Down syndrome. Cystic hygroma is usually Turner's. Third is the cardiac evaluation of the baby. Cardiac evaluation can be done in multiple ways. We can try to look around by doing the ductus venosus. We try to identify the flow of the ductus venosus. Then we try to look around for how is the flow across the tricuspid valve. We can look around for tricuspid regurgitation, and then we can do a complete dedicated cardiac assessment of the baby at 12 weeks also, so as to identify and to pick it up what exactly is happening to the cardiac status and the cardiac abnormality and the cardiac functioning of the baby. Okay. ये कुछ स्लाइड्स हैं जिनसे मैं ये समझा देता हूँ कि हम क्या मल्टीपल कंडीशंस को हम एनकाउंटर करते हैं और कैसे हम इन सब चीज़ों को रूल आउट करते हैं. So as I've told you earlier, this is a cystic hygroma. So we do have fluid in layers and layers to the baby. Okay, so this is all subcutaneous edema, that is very well. ये fluid है गर्दन के पीछे, बुद्धा's appearance है. The complete body in totality is all surrounded with the fluid, and so this is a cystic hygroma to talk about. ये holosystolic tricuspid regurgitation है, which is very pathological. Even though the NT, irrespective of the NT, this TR is abnormal. So this is an holosystolic tricuspid regurgitation and definitely abnormal. ये normal, this is how the normal tricuspid regurgitation looks like. This is an holosystolic abnormal tricuspid regurgitation, right? So this is tricuspid display. This is one case. To start off, the NT was 6.49 millimeters. Ductus venosus is normal. Then we evaluated and identified that the nasal bone is absolutely great. This baby has undergone some investigations and they have turned out to be normal. We are seeing the baby at 14 weeks. This is tricuspid valve and the flow, ductus venosus, which is all normal. So the NT has reduced to something around from 6.4 to 3.5. So that has gone to half. Okay, and then we have done the cardiac assessment, complete cardiac evaluation at something around by 14 weeks. So meaning thereby that all these invasive tests and all these ultrasound investigations, if they turn out to be normal, then it is very reassuring. So the nuchal translucency has turned out to be half at something around 14 weeks, and it is very reassuring, right? But once we identify the invasive test, we can also pick it up microdeletion. which is called as a 22q microdeletion. So what we identify nowadays is this, that 1% could be the risk of this microdeletion, right? Okay, so we do have some aortopulmonary or ARSA or aberrant right subclavian artery in which we can have some risk for this thing, but then this needs to be looked around for. The incidence is something around 1%, right? And secondly, this is the case at 12 weeks. The NT is not that huge, but it is all surrounded with the body, and then we try to look around into the heart, and we identified that this is an overlapping aorta. So the aorta is overriding, so we have had a suspicion of a tetralogy of Fallot with some element of a pulmonary stenosis. So depending upon this cardiac status, we identified that this could be a TOF. So we did an invasive testing and asked for a gene sequencing to the baby, and then we identified that this is a Noonan's syndrome, right? So identifying, so meaning thereby that doing both the microdeletions and duplications so as to pick it up at 22q microdeletions as well as this single nucleotide polymorphism for a Noonan syndrome is mandatory for complete assessment of the baby. Okay. So in nutshell, the diagnosis of increased nuchal translucency and the differential diagnosis is dependent upon the ultrasound. Nasal bone देखना है और ductus venosus देखना है, flow across the tricuspid valve देखना है, tricuspid regurgitation को देखना है और cardiac assessment करना है. So a lot of things are being ruled out by this thing, and then we offer them an invasive testing. Invasive में भी हमको Down syndrome rule out करने के बाद में microdeletions को देखना होता है, जो कि 22q microdeletions और 1p36 deletions हो सकते हैं. ये commonest microdeletions हैं. To complete this story, we are offering them a next gen sequencing so as to look around for some single nucleotide polymorphism and a nucleotide change which is there in a Noonan syndrome and other syndromes. If everything turned out to be normal, then it is very, very reassuring, and then the baby would be absolutely great. We do the echocardiography at something around 14 weeks, and if everything is fine, it is very reassuring, and then we are happy, right? So definitely the baby would need some investigation so as to see that everything is going on with the baby, and if they turn out to be normal, we are happy, and it is very reassuring to the parents as well as to us. Thank you very much for your patient listening.